Hello and welcome back to Med Indian. If you are a NEET PG aspirant, you might have come across the term 20th notebook. Here's all you need to know about the 20th notebook. What is this 20th notebook? We have 19 subjects, and considering each subject has a notebook, we add one extra book that is going to have all the most high yielding, volatile topics of all the 19 subjects in one place, such that we can revise it in the last 2 to 3 days before the exam. Why is this needed? Because obviously we will not be able to read all the 19 subjects in their original form in the last few days because we will not have that much time. And if we don't glance through most of them in the last few days, chances are that we might not be able to recall the important points in the exam.
We did all that just to become strangers again? Damn.
20th notebook is going to be the go-to place for your final revision. But that doesn't mean that you're going to open it directly on the last day or a day before the exam. The idea is to keep revising it almost every day so that the most important topics are at your fingertips by the time you are going for your final revision. So the most important thing is not making the 20th notebook but reading it every single day. You have to at least allot 30 minutes per day for this. So when to start making this 20th notebook? Don't preferably do it in the first read because you will not know what are the important points that you need to include. You will end up making 19 more 20th notebooks. So you will need to filter out only the important frequently asked volatile topics for this. Once you start realizing the pattern, like you finish the previous year questions and start with GTs, you will realize that some topics are getting repeated again and again, or you're finding some commonly asked questions difficult to remember, or you're recurrently making similar mistakes in GTs, etc. So this is when you start making the 20th notebook, that is, once you've finished your first reading. You should not write paragraphs. You should not be writing concepts or including concepts in this 20th notebook. This should only be a personalized book where you are going to have the most commonly made mistakes or the things that you are finding difficult. You can include doses of, say, contraceptive drugs used in OBG, or pharmac emergency drug doses, or cancer staging, CD markers, developmental milestones, surgery scores, pharmac new drugs, physiology formulae, reflexes, named fracture, casts, auto antibodies or enzymes, etc. And also make sure you include some of the confusing topics like Crohn's versus ulcerative colitis, or croup versus laryngotracheobronchitis, and so on. Make sure to make your own mnemonics or some simple ways to remember all of these and revise them along with your when you're reading your 20th notebook. Initially, you will remember them easily and you will think that these are simple. But once you have stuffed your brain with 1,000 other things, you will start forgetting the common things. That is the reason similar questions get asked often in the exam. You might know the answer, but when you see the options, you will get confused. But if you are thorough with these topics, the chances of confusion after seeing options will reduce. Make tables or charts. You can also include mnemonics as an entire notebook or 20th notebook and add the important points that are missing to that notes itself. Make sure that you don't put similar sounding things together in the same page. Example, leptospira versus listeria versus legionella. If you put all of these in the same place, sometimes it's the pictorial memory that helps in the exam. And if everything is in the same page and all three of them are also there in the options, you do not get a differentiating pattern pictorial memory to remember and you will end up getting confused. Should I borrow a 20th notebook from a friend or a senior? The answer would be no, because you can use it as a reference, of course, but there's no point in seeing what somebody else was finding difficult to remember, and if it is not personalized for you, that is what mistakes you are doing, what you are finding difficult, you will end up not reading what is difficult for you a week before the exam. So make it as personalized as possible. You can always see someone else's notes as a reference, but don't use that as your 20th notebook. Next, when to use this? So we are starting to make this after the first read. So make it a point to read it every day, at least like for 20 to 30 minutes. Please don't keep it pending for the last week before the exam. I've told this once already, but most people make this mistake that they keep adding stuff to the 20th notebook. It is important to keep adding things to the 20th notebook as and when you go about it, but don't open it directly on the day of your exam. Don't keep the reading for the last week before the exam only. That is when you're like supposed to have everything at the tip of your tongue and just run through it before the day of the exam. If you're going to open that book to read just before the exam for the first time, you'll get more confused while taking the exam because you would have crammed all the most volatile topics only once, and that too at the peak stress and anxiety levels. So there's going to be no point. You have to make some time, at least 30 minutes per day, to read whatever is there in your 20th notebook. Also, you can make it a point to read the entire book once before every GT you take, as a glance through. This will simulate the day before the actual exam and also make you realize how good your 20th notebook is. Like when you're giving a GT, you have to assess how good your 20th notebook is by seeing if at least 50 to 60% of the questions in the GTs could be answered based on your 20th notebook itself. Like this is once you're done with your 20th notebook. So how to make this 20th notebook? You can use two ways. One is the subject-wise approach, or the other is the random must-know high-yielding topic method. So if you're going by the subject-wise approach, you will be making a condensed version of each subject, the most important and the things that you're forgetting. Say for example, patho will be covered in 10 to 12 pages in total, and physio in 5, and so on for each and every subject. I would suggest leaving a page or two to add as and when you progress if you are going by the subject-wise approach. But if you are going by the must-know topics or the high-yield topic method, it will be a lot more haphazard, but it will include only the high-yielding topics. Like you have only the IV cannula, flow rates, and then you anesthesia masks, flow rate, all those things, whatever is important, but these will be haphazard. These two approaches, either of those you can use based on how you are comfortable. Make sure you use active recall while you're reading your 20th notebook. What do I mean by that? You should cover the answers and try to recall them and know if you can recall them from your memory every time you're reading it. And you can also use one more method where you write the answers in your 20th notebook with pencil and only the questions in pen, and erase the answer every time and rewrite it. That could be quite tedious, but if you have enough time, you could go for that approach. But make sure you are trying to recall the answers every time by yourself. What are the alternatives that you can use if not for 20th notebook? If you don't have enough time, or if you don't feel like writing again, you can make screenshots or photos of notes and make a PDF of that and read it every day before going to bed, like 30 minutes. But you should not just take screenshots and forget it. This has one advantage. You will also be having the images and the graphs in the same place, so that you can remember the images also. You're revising the images also at the same time. If you have digital notes, you can always copy paste and make a 20th notebook. Or if you're using first aid for your reading, you can also use that as your 20th notebook or the final revision notes, and make sure that you add the previous year questions to that so that it suits the NEET and INI pattern. Also, if you want to have an idea about the 20th notebook, there was one that was released by Notespedia on their app, which is available for free. This is not a sponsored video. If you want to check that out, you can check that out it is available for free. That brings us to the end of this video. If you have any other doubts, feel free to ask us in the comment section. We will try to answer it to the best of our ability. And thank you so much for watching. Don't forget to like, share and subscribe.